Okay, we're going to go ahead and get started right now. It is 11:04. Thank you for joining us. We are going to go ahead and start. This is Decreasing Problematic Behaviors with Victoria Wood. We're very excited to have Victoria on board with us today. This is being done through Cole Health. Cole is an amazing company that I happen to work for, and we offer pediatric therapy and ABA solutions for children with any type of developmental delays. We do have several ongoing programs and community trainings, so always feel free to join us for any of those. If you ever need any more information on any of those programs, feel free to always contact me at wendy.maurer@colehealth.com, or you can go to our website, colehealth.com, and we have an info tab there where we list everything as well, and you can just inbox us there. So that's a little bit about us and who we are, but we're very excited. We do offer monthly training every month in the community. Usually it's done within our clinic, but due to COVID, we are going online. So we have Victoria Wood, which is one of our amazing BCBAs, and I can say that full-heartedly and confidently because she has worked with somebody within my family very personally as well. I'm going to go ahead and if you have your mic on, I'm going to ask you kindly to please go ahead and mute yourself. If not, I can mute for you. Just make sure you're mute. And I would even turn your camera off. That way we just have Victoria as she's presenting. I'm going to go ahead and read her intro, and then she'll get started on the presentation. Just to let you know that all these slides are available to you. If you would like us to email them to you, you'll have my email. I'll send it in the group chat here in a minute. Feel free to ask any questions during the presentation, but we ask that you do it within the chat box function. And just know that this meeting is being recorded. Everything towards the end, once we kind of get more to the Q&A portion at the end, I will turn the recording off. We just want to ask kindly that we protect all of our patients and our children by keeping HIPAA in mind, and we don't want to use anybody's names or locations or schools, just the friendly world we live in, right? So without further ado, Victoria is a board certified behavioral analyst who has been with Cole Academy for 3 years. She has been in the field of applied behavioral analysis as a registered behavior technician with a passion for working in early intervention with children. Victoria has earned her master's degree in education and curriculum instruction with an emphasis in ABA through Arizona State University. She has experience working with children with ages 2 to 6, ranging in a variety of needs and developmental levels. With Cole Academy, Victoria has worked on and created great programs such as toileting, social skills, sibling training, feeding programs, and communication. She loves being a part of the Cole difference. So without further ado, I'm going to turn my camera off. Please just make sure to put everything in the chat. I'll put my email in so I can email you out the slides if you like. And thank you very much, Victoria. We're excited to have you. So let's get this going.
Thank you. Thank you, Wendy. I appreciate it. All right, everyone. So we are going to go ahead and get started. And today we are going to be looking at powerful and positive strategies for decreasing problem behaviors. Okay, and the first thing that we're going to look at, sorry. Bear with us here. Okay, there we go. So the first thing we're going to look at when we're talking about behaviors and thinking about the field of applied behavior analysis, or ABA, when we're looking at a behavior, we want to know and find what the function is. So, you know, you have these challenging behaviors, but why are they doing it and how can we figure it out? And we do that using what's called an ABC analysis, which I'll get into a little further here. Okay, so why do we do what we do? Everything that we do, of course, we have a reason for doing it. And when a behavior is occurring, we are looking at why it occurs by manipulating one or more components of what's called a three-term contingency. which is also known as our ABC analysis or model. So here we have it. It stands for, the A is antecedent. So that's what happens before a behavior occurs. And then we have our behavior. So any activity that a living organism does. And then the consequence is what immediately follows that behavior in time. So some antecedents, so that A portion, the very first thing we can look at is, it may be some verbal directives. So maybe you're given an instruction like, go put your shoes on, go have a seat, put your hands down, any type of instruction that you give. And it can also be environmental changes. So saying that it's too hot or too cold in a room, or maybe even looking at the weather, which may change a person's response. And then we also have the presence or absence of people. So for example, we may see when dad's at home, a child is more likely to follow through with a task, whereas when mom's at home, we can't get that child to listen, and there's some struggles there. Or, if mom leaves, the child becomes upset, whereas if dad enters the room, maybe the child is hitting their head and engaging in some challenging behavior. And then we can also look at the passage of time. So an example that we have here would be, let's say your kiddos had a full day of school, maybe working on some new skills and new tasks and things like that may not be the best time, knowing that they've been in school all day and they're probably tired. Or for example, in the real world, we know that there are some morning people and there are some people who are not morning people. You're probably going to be less likely to engage in a conversation with someone if you know that they're not typically a morning person. Okay, and then that B portion of the model is what stands for behavior, which, as I mentioned, is the activity of a living organism. So it's everything that a person does. And it's really important that when we're talking about behavior, or a target behavior, as we like to call it in the field, that we're making sure that that behavior is defined so that we know it's observable, it's measurable. If I see it, I know, okay, yes, that's the behavior that I'm looking at, and making sure that we're notifying, or being clear on whether or not we want it to increase or decrease. All right, and then we have consequences. So we have quite a few different things. Something good can happen. That would be something, it doesn't always have to be planned. It could be totally coincidental, but it still occurs right after the behavior. So that's really important. We also may have it where something aversive stops. So we may have turning off an alarm clock, or taking out some smelly trash. And then we can also see where something bad might happen. We might get, in this example, electrocuted, or maybe we're getting a poor grade on an exam. And then something good stops. So, we don't have that TV anymore. It stopped working. I can't get it to turn on, or I don't have any money in my purse, or no way to pay for anything. All right, and then we can break these type of consequences up on whether it's going to increase or decrease a behavior. So if something good happens or something aversive stops, typically we're going to see a behavior increase. Whereas if something bad is occurring or something good stops, we typically see a decrease in that behavior. So consequences are what determine whether or not a behavior will occur again in the future. We're learning through identifying observations, the consequences, and how to manipulate them. So when we're looking at an increase, we see what we call reinforcement. An example that I give here is a child's labeling an item, and you're giving them lots of praise and attention and all the good attention that you could possibly give them. More than likely, we're going to see that child label again in the future when it comes up. Where on the opposite end, if we are looking at a behavior that's decreasing, that's a punishment. An example here is that the child hits his sister, he gets sent to his room. Typically, it's possible that we see him hit less in the future. And then we also have where there is no change in the rate at all. So maybe he's continuing to hit his sister during the same activities, we're just not seeing that change. occurring in the rate at all. All right, so with using the ABC model, we want to determine the antecedents and consequences to find out the function for a behavior. And we need to do this in order to really look at the behavior that's occurring, seeing what's reinforcing, and manipulate those antecedents into positive consequences. Okay, so we're going to look at an example with the ABC model in this situation. So we look at it here. Mom says it's time to go home. The behavior is the child runs away from mom and says no, he's verbally protesting it. And the consequence, mom's probably chasing and physically removing him. So what can we kind of expect for the next time for this to occur? It depends really on whether or not this is a punishment for him. If it's a punishment, we're thinking that, because we are removing them and reprimanding them, that's clear as day, that's a punishment for them. But if this behavior continues to happen and increases in the future, then we can confidently say that this is not a punishment procedure. It can actually be reinforcing this response. But let's say that we continue to take some ABC data and then it continues to happen. Okay. All right, so we have the antecedent here. Again, mom says it's time to go, child runs. The example here, like I mentioned, we're doing timeout or taking TV away for the night. We're assuming that can be punishing. Let's again kind of look at the next example here. So maybe we're going to modify what we do before. And that's typically what we like to try and do in order to get a positive consequence. So mom could try saying a statement like, I'm thirsty, let's go get a drink. And that behavior we can see in this example changes as the child says, okay, and runs to mom. The consequence is more positive. That child gets praise and they get Kool-Aid when they arrive at home. So another area other than looking at antecedents and modifying those, what happens before the behavior, is making sure that we're aware of stimulus control. And this is something, stimulus control means that it signals reinforcement is available. So in this example here, we have mom's present, Jake asks for money, mom gives him the cash. Whereas when dad's present and Jake asks for the money, he does not give him the cash. So he's then learned, okay, when I need that money, I'm gonna go to mom and I'm not gonna even bother asking dad because I know what the response is gonna be. So you can tell what type of reinforcing environment a person resides in by looking at their behavior. So behavior must be reinforced or it will not occur. And if behavior is occurring, it's being reinforced in some way. Any given behavior at any given time is determined by what behavior has been reinforced in the past for this individual in similar circumstances. So we'll not be able to help someone if we're not fully understanding and using that model of, okay, what has been occurring? How have we been responding to it? And what is reinforcing for that child or person? So it's really important that we take that data. All right, so all behavior serves a purpose. And again, within ABA, we're using an ABC analysis or a data sheet in order to understand that function or purpose of behavior. And then with that, we have some examples here, which I'll go a little further into specifics of what those are and what they look like a little bit later on. However, we have attention, we have escape, avoidance, tangible, and self-stimulatory. So once we find the function, we want to make sure that we're modifying antecedents to change the behavior. And if we can't change the antecedent, then we want to look at modifying how we're responding immediately after or the consequence. So how do we find the function? We use the ABC data sheet. So I'm going to give you an example here, and we're going to kind of take a look at it. So Sally is taken to the playground, and when she gets outside, she's told to go play. And she immediately runs and hits a child. And that teacher's response is to tell her, don't hit, you're going to time out. And this is the same procedure that she's always following. So what can we probably expect that Sally's going to do in the future? She's probably going to hit that child again. So with this, we want to see what we can do to try and reinforce appropriate behavior, and also take a look at, if this is occurring because she's trying to get out of playing with friends, or an escape of function, as we like to call it. We want to take a look at that. So we want to try and modify the antecedent and work on teaching the skill that needs to be learned. All right, so looking at this again, if we are modifying the consequence, we want to teach appropriate play and not allow her to get out of playing with friends, which I know can sound a little less traditional, so to speak, because usually when we're looking at a behavior like aggression, our first response is to, make sure that that child knows that that's not okay. But what's important here is that we're focusing on the fact that this child doesn't know how to appropriate play. So we want to teach that behavior and make sure that they're understanding what to do, so we're less likely to see the hitting in the future. And then, sorry, Wendy, if you could just go back one more for me. And then as well, if we're looking at modifying the antecedent, something else that we can do is actually have the teacher walk out with her to the playground to prevent hitting, and kind of act as a barrier between the child and some other kiddos as well. Okay. All right, so this next example we have is Albert's at the dinner table with his family. He's given food and he's told to eat. Albert doesn't eat, and then when the family's finished with their plates, Albert's able to leave the table. My mom's concerned because he's not been eating anything else but the snacks that she's been giving him. Okay, so we have the antecedent, he's told to eat. That behavior is he's choosing not to eat. Consequence is he gets to go after dinner and have snacks in between meals. So what should we probably do next time, or what could parents do, is probably not offer snacks until he eats his food. And then making sure as well that he's staying at the table until he takes a bite. And again, of course, if we're looking at modifying the antecedents, maybe he's not as hungry because he's been eating snacks all day. So to modify that antecedent, we would just stop giving snacks before meals. So this is an example of a data sheet. And you'll see here, that first column, it says initials. And this would be the person that's actually taking the data. And what's really important with this is that we know who's taking the data, because sometimes, as we've talked about with stimulus control, we can see where a behavior may happen with certain individuals or be absent with other individuals. It's really important that we know how that behavior looks depending on who is with the child. And then, of course, you would write in what happens before the antecedent, the behavior that you're looking at, how you're responding, or the consequence. And then additional comments, maybe things like the time of day or some additional events to kind of note, like, for example, maybe your child didn't sleep very well that night. That would be something that you would probably want to note and keep an eye out for to see if there's a pattern there as well. Okay. So now we're going to look at decreasing the negative. So we know how to use an ABC data sheet, but what comes next? What comes next is using the functions of behavior and using best practices to decrease some of those challenging behaviors. So again, kind of going back to what we talked to just a little bit earlier, we are using this ABC data sheet to find the function. So we have attention, escape, avoidance, tangible, and self-stimulatory. So attention, This can be statements, it can be reprimands, it can be praise. When we're looking at why a behavior is occurring, if it's an attention maintained behavior, it has something to do with those statements or attention, whether it's verbal or physical that we're giving. So some hints when we're looking at attention seeking behaviors. Sometimes it may seem like there's nothing that's happened at all. And if we're giving attention, even such as reprimands, we probably will see that the behavior continues to occur. I know that sometimes the statements that we make are things like, no, don't do that, or the example given here, stop hitting me. But it is important to remember that when a behavior is maintained or happening because of attention, because they're seeking attention, any attention, whether it's bad or good, it's giving them exactly what they're looking for. Right, okay, and so in the model that we have here, we have mom's talking to a guest, child hits the guest. The consequence is mom says don't hit. So if it's for attention, what do we think is going to happen next time? More than likely, he's probably going to continue to hit the guest again. So we can change this by ignoring that behavior and having mom and the guest move locations. And I can understand too, you know, in some of these situations, they are very difficult, especially when there's another person involved. It can be, you know, a little bit more embarrassing when your child is coming up and hitting someone that's in your home. But what is important is that when we are focused on decreasing these behaviors, that we remain consistent, ignore it, and just use some of what we call those best practices to move locations and avoid that ability for them to hit. Okay, so then we have escape maintained behavior, and that can be escape or avoidance. And with this occurs after a demand is placed. And it can also be avoidance. So if we're giving warning statements like it's almost time for school, that may be a signal of, okay, I don't want to go to school, so what can I do to prolong this from happening or avoid even having to go to school? What is very important with this type of function is that we're sure to always carry through with the demand that's given, and we're not going to give attention for not following through. That's really important because what we don't want to see happen is a behavior that starts out as to try and get escape, turns quickly into attention because we're giving that attention to them for not following through. So the example that we have here is mom says, clean up your toys. The behavior is he hits his mom. The consequence is that mom says, ouch, don't hit me, puts him in timeout, and she picks up the toys herself. And as a result, he never has to pick up those toys. So looking at the consequence, what we can do here is we can have mom ignore the hitting and prompt the child to pick up the toys. And what we mean by prompt is you may need to hand over hand help them, or sometimes we give just a cue, like a gesture to kind of show them this is what we want them to do. But it's really important that we refrain from ignoring by making statements about the hitting in order to make sure that we're not giving it attention. So when we're thinking about why she should ignore it, to avoid giving attention to the behavior. Okay, and then we have denied access, and that's when a behavior is occurring to try and get access to something that an individual wants. So behavior occurs when they're not getting access to what they want. However, it's really important that we do not give them those items when we see the appropriate behavior, inappropriate behavior. We don't want to teach them that by hitting, I get access to what I want. Some other options that we can give or do is by other options that are appropriate or are available to them. We can also remove the item completely that they're looking for. So the example here, The kid sees a toy on the shelf and mom immediately says no. Behavior is that the child is crying, and consequence is mom decides to go ahead and give him the toy. But if we're looking at consequences again, we will see mom ignores the crying and continues to shop. That could be one option. And then if he can have the toy, make sure that they're stopping the crying first. So what we don't want is, again, that immediate consequence of I cry, I get the toy. We want some time to pass. So either it's not available and we just keep on going and completely ignore the crying, pay it no attention, or if they can, make sure some time has passed and they're no longer crying before you allow them to have the toy. And we can also look at modifying the antecedents too in this situation of bringing a toy for them to have as another option. Okay, and then we have self-stimulation, and the behavior occurs just to occur. There doesn't need to be a person present for this behavior to continue to happen. They're just doing it simply because it's rewarding for themselves. So some hints for behaviors that we see that have a function of self-stimulatory. We want to first try and figure out why they enjoy engaging in that behavior. So what are they gaining from it? Is it a visual? Is it a feeling? Is it a sensation? And then once we find that, for that specific child, we want to find what's called competing reinforcement. So the example that I give here is with hand flapping. Maybe it's a fan blow on the face or a similar visual that they're getting from seeing the motion of the hands that we can replace. And then last thing here is we can look at blocking as much as possible. Blocking is something that we would do to kind of bring their hands down, but it's also really important to redirect their hands to what they can be doing appropriately at that time. So kind of getting them engaged in something else with their hands so that hand flapping is not even continuing any longer. Okay, so what if we don't know the function? If we're not sure what the function is, we can always use common basic practices. It's really important that with those best practices, we're not giving attention for inappropriate behavior. We want to make sure that we're using silent prompts, and if we're redirecting them, not giving them any eye contact. Also making sure that if a demand or instruction is put in place that they need to complete, that they complete that, don't take that away. And then we can also remove all reinforcement. So removing toys directly from the kiddo's hands. And a lot of what we use at Cole and would be a best practice for any child would be to remove that item using a statement, my turn. What that signals to the kid is that, this is turn taking, this item's not gone forever, I'm gonna have a chance to have that back again. So example here, if we're seeing an attempt to bite, we're gonna take away the toy. And then we also want to make sure that we're not allowing access to that toy or whatever that reinforcing item is until they're being appropriate. Okay, so with increasing the positive while decreasing the negative behavior, we move a little bit past best practices. If they're no longer getting reinforced from the problem behavior, we want to look at how can we get the reinforcement that they're really looking for. And we do that by introducing more reinforcement procedures. Okay, so it's very important to remember, we still can use some best practices when we're looking at this, but we also want to make sure that we have the attention of the child when we're giving instructions, and just be prepared to give prompts and also fade prompts. And fading them is just as important because we want to make sure that they're not becoming what's called prompt dependent, that they're not always looking for you to help them out to complete a task and follow through with an instruction. And we also want to use some behavior momentum as well. So looking at having them complete some tasks that they can and then working on that more difficult task. We also want to make sure that we're giving some choices and providing options that helps give that child feel like they have a little bit of control as well. And we also want to be aware of who's giving the demand. So like we talked about with stimulus control, making sure that it's the same consequence with each person. If you guys are having some difficulty with that, if it's, mom versus dad, I would suggest pairing yourself. So for example, if mom has, gives the instructions and that child follows through every time, but with dad, we're just not seeing that happen, they can come together and pair. So be present together when that consequence is given. Okay, and then we're going to look at some reinforcement procedures. So we have functional communication training, or FCT, differential reinforcement of other behaviors, DRO, differential reinforcement of alternative behavior, DRA, and non-contingent reinforcement, NCR. And today, just for the purpose of this presentation, we're really going to focus on functional communication and FCT. All right, so with this, we want to make sure that we're giving a child an opportunity to access reinforcement, but sometimes we do need to teach them how to do that correctly. We may do that by teaching a child how to appropriately ask for what they need or want. But we want them to know how to gain access to that, because if they never know, we're probably just going to continue to see the same behavior. That's probably more challenging. But we want to make sure, again, that we're looking at the best practices with this. So the example that I give, if a child's hitting mom because he wants mom's attention, we want to make sure that no attention is given. That means no verbal statements, eye contact, anything like that. But instead, using FCT, we want to teach them to ask for that attention. And it's important that that comes before that hitting behavior. So we want to make sure that when we're teaching it, we're teaching mom's busy, that's our antecedent, immediately helping them understand, I can ask for attention appropriately, I get mom's attention. Okay, and then when we're looking at an example here using the ABC model, we have mom's talking to a guest, child hits the guest, we're not reinforcing the hitting, and mom and guest move locations. When we're using functional communication training, next time the child approaches mom, mom's going to block that attempt and have him, and immediately tell that child to say hi and reinforce that the child is saying hi and not engaging in hitting. Okay, so in this example, a child is given a tough assignment and the child hits. We're not going to reinforce the hitting by ignoring it and keeping the work. However, using functional communication training, before we even see that behavior occurring, we want to teach them to say, I need help. Or maybe if your child is not verbal, they're using sign language or a picture exchange communication system, which is known as PECS, to let you know what they need. Okay. So we want to make sure that we're sticking to the program that we choose, or we may see some accidental reinforcement of the wrong behavior. We want to teach them that the inappropriate behavior is not getting them access to what they want, but I am going to give some examples here. So in this one, Rebecca's talking to another adult, and Rebecca begins hitting her head, and mom runs over to show concern in order for her to stop. So in the future, Rebecca's probably more likely to hit her head because she got mom's attention in that moment. Okay, and then in this one, we have dad's telling Emily to put her shoes on to leave. Emily says no, doesn't want to put on the shoes. Dad suddenly gets a call that's rushing him to go into work, so he picks up Emily in the shoes and just gets right into the car. It's important to know in this instant, when we're looking at a demand, we want to make sure that obviously we're following through, right? But in this situation, dad's getting a call, it's rushing him, it's in the morning, it's time to go. There's just really not a lot of time to sit and work on the skill and work on that compliance. So I would be mindful too of when you're presenting that instruction. So if you know that for your child, a specific task like this with getting their shoes on in the morning is a bit more of a struggle, I would refrain from even giving the instruction and just doing it with them, and then maybe working on them actually following through, doing what they need to do with putting shoes on at a later time. We have a little bit more time to work with them on this. All right, so what happens if reinforcement doesn't work? So I'm going to give some examples here of some things that, statements that you may think when we're seeing that reinforcement doesn't work. So I've stopped giving reinforcement for inappropriate behavior, and I've started reinforcing appropriate behavior, but he's still doing it. Or maybe it's, I can't ignore his hitting all the time, it really hurts. Or maybe I'm ignoring it, but I have to block, and that's just enough attention for him. And then we can also see sometimes where maybe we can't prompt the task because he's too big. Or we have where it's just getting worse. So we're going to really look at those two statements right there first. So if we've stopped giving reinforcement for the bad, reinforced the good, still doing it, and it's getting worse, that's what we call extinction. And that is when you're stopping to reinforce an inappropriate behavior, you're probably going to see what's called an extinction burst. So you're going to see that behavior intensify. It's probably going to become more frequent, maybe more severe, but it's really, really important that we still give the reinforcement procedure some time. So we really want to make sure that that kiddo has time and is understanding that we're not going to give in, and we're not going to give them access to whatever they're trying to get access to, or whatever that function is for the inappropriate behavior. What can happen if we do is we might accidentally reinforce a behavior that's even worse than what we originally started with. So I'm going to give you guys two examples. One is going to be a Coke machine to get access to a Coke, and another where head hitting may occur to get access to a toy. All right, so in this example, we walk right up to the Coke machine. And this is one of our more classic examples. So you walk right up to the Coke machine, put your dollar in, but you're not getting access to that Coke. It's not coming out. So what are we probably gonna do? We're probably gonna shake it a little bit. We're gonna be a little frustrated and maybe even put a little hit or kick in there. Where is this Coke? I put my money in, but that's not working. So maybe we call in and we phone a friend, start trying to shake it a little bit more, hit it, see what we can do to rattle out that Coke. And then if that's not working, we may even just get a whole group of people to help us out. At what point is my Coke gonna come out? What do I need to do to get it? Okay. So in this next example, we see head hitting to get access to a toy. And let's say that they're not getting access to that toy, so they begin banging their head against a wall. And that's not working, so they hit their head with a hard object. And then even further than that, that's not working, so they're going to bang their head against a wall while hitting it with a hard object. So what we can see here is what happens if the Coke comes out, not when it's just us shaking, but when it's you call in a friend and all of a sudden the Coke comes out and the two of you are shaking it. You're probably going to see that in the future, you're not going to go right to that immediate shaking it yourself or looking for it, and you're just going to go right to calling in that friend because that was what was last reinforced. Okay, and then in an example with a child head hitting to get access to a toy, that initial head hit's not getting access to the toy. Banging the head doesn't get that, but hitting your head with a hard object gets you access to that toy. So we probably will see the next time that kiddo's not going to worry about those other two options. They're just going to go straight immediately to hitting their head with a hard object because, again, that's what got them that toy immediately after engaging in that behavior. Okay, and then the same can be said here for what happens if those first 3 options aren't working with the Coke machine, but we need to get the whole group of people, they're gonna, again, jump right into getting a whole group of people when they go up to that Coke machine to get their Coke. And again, looking at head hitting. If head hitting by itself is not getting access to the toy, neither is banging your head against the wall, neither is hitting with a hard object. But as soon as I bang my head against the wall while hitting with a hard object, I get the toy, I'm probably gonna jump straight to that because that's what's been reinforced. But what we wanna teach in these examples is, or what I wanna explain in this example as well, is what happens if we're exhausting all these options, and even when we call in a group of friends, that's not getting us access to the Coke. What we're gonna see next time is we're probably not even gonna bother going to that Coke machine because nothing I do, no matter how intense, it's not getting me access to my soda. And same thing in this example with head hitting. If I'm exhausting all these options and I'm still not getting my toy, I'm not even gonna bother going to try and hit my head or try and get access to that toy because I know what I'm doing is not giving me that item. Okay, so if we can't ignore the hitting because it really hurts, it's really important that if it is for attention, that we're removing ourselves from the room. And be mindful if you are giving a demand or instruction of where you're placing yourself. You may want to stand behind the child if you're able to, if it's something where you need to prompt them through a task where it may be less likely that they're able to hit you. And just remember, if you do need to take a break, because it happens to us all, that's okay, but just make sure that we're still following through and going back to the original demand. Okay. So I'm ignoring it, but I have to block, and that's just enough attention that they get. Again, we want to remove ourselves from the room, but be mindful as well. If it's a self-injurious behavior, we want to try and block it and just make sure that we're not giving eye contact, no statements, just as minimal attention as we can. When it comes to more severe behaviors, we want to provide the least amount of attention, but still keep that child safe. Okay, so then what happens if I can't prompt him to complete the task because he's too big? Well, we can present other tasks and we can come back to that original skill afterwards and kind of build up some behavior momentum before presenting it. But also if it's a skill that your child knows, keep in mind that maybe you just continue to present the demand, within a certain amount of time, keep that instruction present. Don't provide any prompts and essentially wait them out. Wait until they follow through. All right, so we've talked a lot about reinforcement and not so much of punishment. Why don't we typically recommend punishment? Typically, when we're looking at punishment, it's essentially we're putting a lot of emphasis on teaching a lesson and not so much decreasing a behavior. But we want to be focusing on teaching a behavior that we want. And with that, a punisher needs to be present when we're using those type of procedures. Oftentimes, we have to even increase the amount of punishment that's needed in order for it to be effective, which can be dangerous. There might be a temporary stop to a behavior, but we may see that behavior continues. It doesn't completely go away. And it doesn't allow a child to access reinforcement. And we also want to make sure that we're teaching appropriate behavior, and punishment procedures do not teach appropriate behaviors. And then lastly, accidental reinforcement. So if we're giving time out when we're looking at a behavior that's happening for escape, or a reprimand when a child's looking for attention, that's why it's really, really important that we know the function and are aware that it's only a punishment procedure if there's a decrease in behavior. All right, so do we think we have it? We're just going to go over some reminders here. We want to be aware of what we're doing. So behavior is determined by previous consequences, whether or not those consequences are planned. We want to make sure that we are looking at manipulating the antecedents. So what can we do before the behavior happens, and really, really focus on those positive consequences. So making sure that reinforcement comes first. And then we also want to make sure that we're not accidentally punishing a good behavior. So the example that I give here is, maybe we're seeing the child as saying, I ate all my food, but our focus is on the fact that the child's clothes are dirty. Well, we may accidentally be punishing that good behavior of eating all the food because we're just so focused on the fact that the clothes are dirty. So really making sure that we're aware of those things and providing that good praise and positive consequences when needed. And then we want to make sure that we're avoiding accidental reinforcement. And with that, there's an example that I put at the bottom there of a child acting out in church. If we're looking at, they're trying to, again, looking at the function, if they're trying to get out of sitting in church because they're bored and they're just ready to go and they're acting up, by taking them out, we're giving them exactly what they want. Now, again, in that situation, I would say, look at how you can modify the antecedents. Are there things you can do beforehand to help maybe keep them preoccupied during that time? That's maybe a little bit more quiet, that will still have them sitting and being a part of church without seeing those challenging behaviors. So always know that you can look at modifying those things that we're doing before behavior happens. Okay, so I know we went over a lot. But again, I know Wendy kind of mentioned to you guys, there's the chat box, so feel free to ask any additional questions, comments. I have my email address as well. You guys are welcome to email me at any time. I just won't be able to answer any specific questions about your child. It's really, really important for me that I'm taking data and I'm observing what's going on before I can make any type of recommendations. But if you do have questions about, specific procedures or using the ABC data chart, anything general to the topics that we discussed today, please feel free to get in touch with me at any time.